Coming up on the Sports Spotlight Series, Mass General Brigham and Boston College football teaming up to work through the challenges of a Division I football season.
Flowers, got to make a man miss. Can't, but he's able to pick up good yardage. Crowd wants a flag, and they'll get it.
Let's go Kent with it.
Ooh, and that's not a good sign. Flowers going in the tent.
Is it this one?
These two.
Okay. All right.
Give me like 10 seconds.
All right, let it calm down for a minute. Yeah, no, I got him.
I'm good.
Hold on. You never look back to see what the fans are screaming for. You're completely honed in on the athlete. The athlete is not honed in on you because they're in the moment. Really, use your best judgment at the time with what you're seeing to decide very quickly, is this safe, is it not safe? And that's a hard thing to do. Yeah, he's like, you know what, it's good. I was like, whoa. I just kind of no crepidus. He's like, I gotta go.
Everybody sitting at home is watching the play in slow motion. We don't have that luxury to see that play. So talking to the player, examining the player, and then determining if they can go is really important.
This is not a problem, right? Turn it around, make a fist for me. Good, straighten it out. Yeah. When we're there for a game, that's like 5% of the whole week's worth of work. Everything else happens Sunday through Friday.
In the big-time world of college sports, it is vital that health and wellness be the highest priority. To have a successful athletics program today, colleges go to extensive lengths to provide their student athletes with the top coaches, trainers, and medical staff to ensure the best care. That's why Boston College Athletics has partnered with Mass General Brigham as their exclusive healthcare provider.
I've been working with Bobby Nascimento and Tim Foster for multiple years, and that relationship started with Newton Wellesley back in 2015 and has merged into Mass General Brigham, with Newton Wellesley being a part of that entity.
MGB also provides clinical services to the Boston Bruins, New England Patriots, and the New England Revolution, among other organizations, but you can find these doctors at Boston College many hours a week.
BC has a great array of resources in terms of research and academics that they can help with MGB, whereas MGB, is looking for partners like this to be able to take care of these communities, and BC is really a community.
For it all to run smoothly, the doctors work closely with the Boston College training staff, led by Michael Vigneault.
I think we're incredibly fortunate to have such immediate access to such elite care. We are with the athletes every day for multiple hours a day, so we do get to know them very well. And then the doctors are with the athletes fairly often as well, right? So we don't have a single athlete on our team that Dr. Nascimento hasn't done an initial orthopedic review their first week on campus. I think it's a great relationship.
Mike is an incredible trainer, and when you think about how much time he spends with the athletes, it's amazing. He is a second parent to most of the athletes, so he knows where they are in their rehabilitation program. He knows what their injuries are. He's an incredible asset.
You're an athlete and you're trying to get better.
Our trainers and our doctors, they've been outstanding, whether it's them performing the surgeries and them doing the rehab, and I think we're under really good care.
Yeah.
We have world-class surgeons. We have people who understand concussions, cardiologists who are world-class. So we have a great hospital system that can provide amazing care to these athletes. And Boston College itself is a world-class institution. So you have two world-class institutions who are working together.
I would say like right there and there and there.
They had to put a lot more of that fluid in because they didn't leave the tube in.
Good, again, good.
Pre-game, we typically get to the stadium about 3 hours before for home games. Typically, we would know which student athletes are either injured or ill prior to a game. Some people do like pre-game adjustments like osteopathic manipulation, which is what I perform.
All right, a little poke. Almost done. A little bit of it is trying to figure out who's 100% ready, who's kind of on the cusp, and who's definitely out.
How's that feel?
We have a pretty good idea of who's going to play and who's not going to play that day, but there are some players the day of the game that we're not sure about.
Looser. Awesome. Have a good game.
Football's a
pretty dangerous and pretty violent sport. And so we kind of know by Tuesday, Wednesday of that week what our plans are.
I think you should go in the booth one more week. One more week, all right? There's always going to be that like game day decision making for one or two guys, and it's a constant back and forth of trying to balance that. Of course, yes, we know it's safe, but are they going to be able to be productive on the field as well?
As a sports medicine provider, we kind of toe the line a little bit in terms of pushing the envelope, mostly with consent and or acknowledgement from our athlete that this is what they want to do.
Fortunately, I know that if I say something, the docs and I have already discussed it, we're on the same page, and they have my back. And they know that if they say something, I have their back with the athletes and the coaches that I'm seeing every single day.
Past injuries play an important role in evaluating a player on game day. Both linebacker Vinny DePalma and defensive tackle Chibuzi Onwuka have had a torn Achilles surgically repaired by Dr. Nascimento.
An Achilles rupture, essentially there's so much pressure and load on your calf muscle when you're trying to push off, and you can rupture the tendon that is trying to do that motion because the muscle's so large compared to the tendon size. These guys, it's just they have massive muscles, so the tendon essentially tears in half, and what we need to do to repair it is we just go in surgically and sew it back together to let it heal in the normal state.
I was just doing what I do, practicing, go full speed, and just took a bad step and felt like a pop in my lower extremity. I knew it was something bad just because there was so much shock in the area.
I was coming out of blitz through the line of scrimmage, and I went to turn and run, and I just went to step, and I feel like I got stepped on or kicked by like an O-lineman. I limp off the field, and I get to the trainer, I'm like, I think I got stepped on or kicked, and I kind of saw his face and his demeanor change because as I came to learn, like that's kind of the telltale sign of tearing your Achilles.
Achilles tendon injuries can be devastating because it's not hard to repair surgically. It's actually quite easy to repair surgically. The hard part is the rehabilitation.
It takes a long time because the amount of muscle atrophy that happens after that type of tear, because you have to let the tendon heal and rest for a good 6-8 weeks, these guys lose a lot of that muscle mass. It's actually well documented. It takes anywhere from 9 months to a year to return from an Achilles. Now, both of those guys actually were back at 8-9 months, which is pretty early. I was surprised, but that goes into all the hard work they put in.
And you always hear about athletes returning to their sports quicker than the normal population does from their injuries, and the reason why all that's possible is the constant care that we're able to provide, but also the constant reevaluation that we have with our physicians that we're comfortable in progressing these things as quickly as possible.
Leg injuries are by far the most common injury in football, the most frequent injuries being a torn MCL or ACL.
The ACL helps with rotation and helps with translation of the knee. And it's a devastating injury because it takes 6 to 9 months to return. We've gotten to a point where we feel pretty good about our repair in terms of what we use to reconstruct it, especially in these young athletes.
So we harvest a portion of the patella tendon, and then arthroscopically that gets inserted in the knee as the new ACL. They are really hard to rehab from.
The doctors also see a lot of injuries to the meniscus. Defensive back Jason Maitre is very familiar with the surgery.
So the meniscus is a cushion within your knee, essentially between the femur and the tibia. And if a meniscus tears, it causes pain. But it can be surgically repaired arthroscopically, or a portion of the meniscus can be removed. Patient comes into the hospital for the day, 2 little tiny incisions after general anesthesia. We look in their knee with an arthroscope. And through the second incision, we have special instruments that can either stitch the meniscus or partially remove the meniscus.
I never really had a surgery, so they really knew my limits kind of more than I did. And when it was time for me to push, they knew when to push, and when it was time for step back, they stepped back, and I think they did a good job with that.
The mental side of getting injured, they quickly go to that place. I don't know if I'm ever going to play this game again, and it's a constant positivity, highlighting what we know about the evidence. When we do this operation at MGB, this is what happens. We're better than the average, we're this, we're that. We try to be modest, but sometimes we have to tell our athletes, this is what we do, and this is why we do it.
When we come back, it's game time, and the Mass General Brigham staff is called into action. This may look like the doctors of Mass General Brigham enjoying a college football game with the best view in the house, but it's only a matter of time before they are needed.
It's all a team effort. None of us could do this by ourselves. And the camaraderie of like us trying to do the best for these kids makes it the best.
I think he just had his groin wrapped. It's more of a groin strain, I guess, right now, but we'll see.
Sounds good.
You didn't see anything on the ultrasound, did you?
No.
Going into game mode, we are on the sideline, but we have our eyes not only on the play itself, but also behind the play, because what happens behind the play is what we're going to end up seeing, most likely. It's somebody that gets hurt behind the scenes or maybe on the ground behind where the ball is going.
And Takis is injured on the play, and that is not a good sign.
The nice thing about having a pretty skilled athletic trainers is that they're actually your triage specialists. They're the folks who are on the field assessing an athlete if they're down from a musculoskeletal perspective. And then by the time you get to the sideline, I'm going to hear from Mike or one of his assistants what's actually going on with the athlete.
Push in this way a little bit. Yeah. Push out. Okay. Let it relax a little bit now. You get the x-ray, it looks okay. Then we'll tape it up a little bit harder and kind of see what we can do, right?
Okay.
All right. Did you take anything before the game at all?
Advil and Tylenol.
Okay. How much Advil?
5 pills.
Okay. Anything there?
Huh?
Anything there? And nothing on your toe, right? Okay. I don't think it's fractured, but let's get the x-ray real quick, okay? We might want to... Yeah, so I don't know if he's going to be able to walk all the way over there. I got some crutches.
I'll walk. Okay.
You sure?
So he needs a stretch. Where am I going? You're
Crutches or are you walking?
No, I'm walking.
You're good. We do have an x-ray unit right in the field house. So player comes out of the game and one of us takes the player back. Sometimes they have to be positioned in the x-ray by the doctor, but it's really important. It's really critical.
Okay, we're just going to walk through the door and then to your right. Okay. Here we go.
We talked about getting a stress view. Stress view is just as good. If you could get weight bearing views, it'd be easier. It'd be better to see.
Most college campuses now either have x-ray or a portable x-ray machine on site. That's helpful because, you know, if something's broken, then you know functionally it's not going to work. We've got it down to a science where when we're in the tent, we decide an x-ray. They're literally getting that x-ray within 2 minutes.
George Takis. TAKACS.
Maybe a little bit more rotated in.
A little bit of the medial clear space.
The results of that x-ray either are text to me via picture or I'll run into the x-ray room to kind of look at them to make that final call.
You're not going to be able to go back today, so let's see where we're going to take you.
Where do you want him? Do you want him to go to the locker room or?
Yeah, because if he's wide, non-weight bearing, I think we're going to need to go to.
We're going to head back toward the training room. I need somebody to open the door there. Here we go. Come on, get in. There it is.
There we go. There we go.
Sometimes they get retaped again, and then we'll have them do some running on the field for us and cutting back and forth. In George's case, it was very clear. He had a difficult time even walking.
When you can see the injury happen before you on the field, you know what the mechanism was, you know what the signs are, can't even bear weight on it. But, you know, these kids are tough. They can fool you sometimes. So for him, it was pretty clear as soon as we got the x-rays that, you know, he wasn't going to return.
Worried about this ligament here? That's where it hurts the most, right? Does it bother up top here a little bit too? Yeah.
With tight end George Takis officially ruled out of the game at halftime, things get a little worse for BC as backup tight end Spencer Witter needs stitches to his knee.
It doesn't matter.
You just soak up just to prep him. And here's the first thing we're going to do is we're just going to put some sterile solution on this. Oh, sorry about that. Yeah, it stings a bit. Sorry about that. Sorry. It's difficult, especially when other players in that position are off about, and to go to the coach or to have Mike go to the coach and say, I'm sorry, he's out for the day. That's a really difficult position to be in. But once again, we have to do what's best for the player.
Jesus, what did you do, man?
I don't know. I just looked down in the huddle. I saw that I had a V on my knee, and I was like, that can't be good.
Can never have too much clean.
You got to have your poker face on at all times. If they feel the negative vibes, then they're going to completely go to that bad place pretty quickly. In sports, we're used to positivity. We're used to trying to look at the glass half full. Sometimes it's hard because sometimes you kind of know deep in your heart. We have to get these kids out of the moment. Once they're out of the moment, then they can come back down to quote unquote reality.
It's nice and clean and not like you said a V or.
Second half now, and it's back to the sidelines for the doctors.
Are the fingers numb right now, or are they okay?
Fingers good.
All right. Were they numb for a little while?
No.
No? How far down did it go? This finger go? Just to the back of it? Okay. Anything back in the shoulder blade here?
Having the tent allows us to have more of an exam room style on the sideline. It allows the athlete to focus on our interaction as opposed to looking around to seeing if people are watching, and also it helps be less of a distraction to the athlete with their teammates coming and checking in on them while we're trying to do an assessment.
Pull it in that way. It's a little bit better. Okay. All right. Well, let's give it a minute, okay? Because right now you're in no position to protect yourself, right?
If somebody has a stinger, they lose their deltoid function and they can't raise their arm. They can't go back into the game until that comes back.
We can't let you go back in until we know that nerve gets better, okay?
It's just a nerve thing.
He's got a lot of weakness.
Yeah.
He's got like a little C5 palsy. So let's give it a few minutes, okay? Let it calm down, and then we'll retest it again. You cannot go back in the game until Mike tells you it's okay.
All
Okay.
right.
A lot of times it's range of motion, strength, flexibility, and is this an injury that you can come back from? How many of these have actually returned successfully without having major problems later, and or making sure that you're not going to have a major problem while in there?
He's got no neck pain, so that's good. If his strength comes back, he's fine, but I think the chances on this one, pretty low.
A few injuries will actually sit on them for a little while and say, all right, well, let's hold you out for a couple of series here. Let's see how it feels. Let's not ice you down yet, because if we ice you down, you're out.
It's going to get there.
There's always going to be that sense that the team may want someone back a little quicker than the athlete, but it also sometimes goes the other way, where the athlete wants to get back and they're fighting to get back, but it's really not safe.
Yeah, I mean, I kind of told him there was little chance, but
Everybody up!
Perfect.
And that'll do it. Gutty win for Boston College, picking up their first ACC win of the year.
The most important thing is to know that player, to know what's normal for them, especially if they've been injured in the past, that their sense of balance is normal, that their neuromuscular control is normal. If that's not back to normal, by the time they go back to play, they're risking another injury.
What we want to do is get an x-ray of your shoulder and your neck just to make sure that those are fine. We're not going to see anything really, but just to be safe, okay? And then we're going to give you some medicine tonight to kind of help that nerve wake up a little bit quicker.
Okay. Can I come up now?
This is going to be really important for you.
Keep it on.
Yep. We're going to use it kind of like a cast overnight, right?
Just sleep in it.
Even sleeping in it, yeah.
Before they even leave the facility, I think it's important to tell them this is what you're going to look for. This is what we're thinking, but we'll check it again tomorrow to see like if we're all right, if we're all on the same page.
So we'll give you a little something for before you go to bed tonight.
Okay. All right.
We will return with more of the partnership between Mass General Brigham and Boston College Athletics after the break.
How'd it do? Did you do all right, Jack?
It would be nice to get a break after a big game day, but it's no days off for the BC trainers and doctors of Mass General Brigham.
All right, bring it here like this.
After every single game, we have our team docs in the next day, and every player on the team who took a snap, they have to come in, check in with us, and let us know how they're feeling and what they're feeling.
A lot of times I look at it, I'm like, all right, tough guy routine's over. Let's really talk about how you're feeling, what's going on.
Guys that got nicked in the game and they just want to get out of there after the game's over, this is a great opportunity for us to get our eyes on them, get Doc's eyes on them.
I heard you're feeling pretty well from the concussion and you did a little exercise today. Cool.
If they have any signs of concussion or any symptoms, they're automatically pulled from practice. We would continue to monitor them during the day and check in on them daily. We have different techniques with our neurotrauma rehabilitation specialist on doing concussion rehabilitation early on, so then that way we can help mitigate some of the symptoms.
It's putting a puzzle together, and a lot of coaches know not to ask too soon. How's George's ankle? Well, he's not good today, but he might be good for next week. We'll find out.
We treat everybody the same from a patient perspective, whether it be a student athlete that's expected to go #1 pick in the draft versus somebody who's going to be an undrafted free agent versus someone who's going into business.
Of course, it's not just BC football that gets the benefit of working with Mass General Brigham.
There are 750 varsity athletes. There's another probably 800 club athletes. And really it's just kind of managing all that care and trying to make those quick decisions on what happens here, who should that person see, what should we do now, let's go get an x-ray, let's do this. And it's really pretty fast-paced, and it doesn't stop.
And the doctors at MGB would not have it any other way.
I like how every day is different, and I love seeing patients. I really take pride in getting to know our students and our student athletes and trying to get them as healthy and as safe as possible.
The best thing is the relationships that you form, but just the athletes themselves. Whether you've treated them for something major or minor, I think eventually most of them reflect and come back. And when they come back and give you a big hug on the sideline in an NFL game, like, hey doc, remember me from BC? And I'm like, absolutely, 100% I remember you because I remember all you guys. That little thing.
When they go back on the field that first time, I'm thinking to myself, oh boy, I think everybody would have a little bit of worry. But then to see them play and play and play, it is such a feeling of gratitude.